what is your name and what do you do? Like, what's your profession?
So my name is Jeff Krug, and I'm a assistant professor here in the physical therapy program. So I've been teaching here 14 years, and I also oversee all the student activities for our physical therapy program.
Okay, great.
Okay, cool. Okay, why did you decide to pursue a career in physical therapy?
Yeah, let's see. Well, I think I went and observed. I observed PT, I observed OT, and a few other things. And what just appealed to me the most was the fact that, we're getting paid to help people, right? So, how fun is it to go to work and be able to work with people and talk with people and help people as your job? So I really like that aspect. And then I like the fact that it was science-based, so there's a lot of really interesting science behind what was being done. It wasn't like the people were just making stuff up. There was a real reason for
Right.
what was being done.
So this is kind of similar, but what do you value about teaching?
Yeah, well, it's nice to have an impact, or at least try to make an impact, because that impact doesn't just affect the students, but that's a big part of it, right? What I really hope is that students walk out of here impacted in a lot of ways, just wanting to do service, wanting to care for others, wanting to do really well as a physical therapist, so really work hard every day and do their best. But also the fact that, if I can kind of guide students in that way, then they're going to give that to their patients and other people as they're doing service as well. So I guess I'm just hoping to have some sort of impact or help, be able to reach out and touch others just through being able to have contact with the students.
Definitely.
Yeah.
And how do you, what ways do you feel work best, like when you try to reach people in your organization, like or make that impact you're talking about?
Yeah, well, talking with people is important, and being able to have that ability. So we look for students here that have the ability to talk with others and interact well, because you have to build patient trust and really have them buy into what you're doing, right? So that's part of it, but I think, as we're teaching classes, part of what I like to do is a lot of hands-on type stuff. I want the students to ask questions. I want there to be more of an interaction, not just me telling them things. Nobody wants to do that, right? So I like there to be an interaction. I want them to be interested, so trying to generate interest and hold their attention, and it's a challenge all the way around. So, but I like that challenge. I like trying to meet that and really engage them, right? And I just want them to realize how meaningful this profession is and what caring for others, how much value there is in that. So if I can impact them in that way, then that's a good thing.
Yeah.
Tell us a little bit about adapted gymnastics, how and why you started that. Kind of what was your incentive and how you went about it and why?
Yeah, well, I didn't actually start it, so,
Okay.
it was started before I got going.
Okay.
It was a program that started 21 years ago. Max was part of it, and there was a physical therapist that taught in the program that was part of it. And they began it, and then it got passed along to a different faculty member, and then she passed it to me about 7 years ago. So I was aware of it, and I had come and observed and participated a little bit, and supervised, filled in for that other faculty member sometimes. So I just saw great value in the program. And so what we've tried to do then is grow the program. So over the last 4 years, we've gone from, say 20 kids participating to, we have a list of 80 kids now. So we just tried to make it something that people are more aware of, that it's a place where kids can come and just be kids and have fun and run around, right? But also maybe learn some skills, and then get some skills out of it, physical skills, social, some interaction type skills, understanding maybe how to follow some directions and follow what we're doing. And then for the families, just for them to be able to sit and observe and watch their child be successful, or maybe just come and chill for an hour, right? It can be exhausting. So if they can just come and talk to other parents or even just relax, then that's good for them too. So I was excited to get involved in it, and then it was even more fun to figure out how can we grow this and make this even bigger. So we've been pretty successful that way. I'm happy about that. And then a good side effect is that, one of our students that did adapted started an adapted skating program down in Jeff City a few years ago. One of our other grads started adapted dance program with a company here in town. There's a therapist in town who started adaptive cheer. So we've got more options now for these kids, right? It used to be that adaptive gymnastics was it. That was the only option they had. So now at least they've got some choices, some fun things to do.
I didn't realize how much it has grown. That's
Yeah,
crazy.
yeah.
What has gone well or been hard either in your career or with the adaptive gymnastics? Just what have you found successful and what has been a challenge?
Yeah. Well, I think career-wise, what's gone well is I had clinical experience, and then I came here, and if I wasn't a physical therapist, I wanted to be a teacher. So now I get to do both. I mean, how cool was that, right? So you get to do that. So it makes going to work easy. It's not like I ever go, oh man, I hate going, because it's just all you young people are so energetic and involved, and so it makes it real easy to go to work and interact with people. So I really enjoy that, and what I've really enjoyed is kind of adding the service element to our program. It was there before, but being able, when I was given the role of director of student activities, it was like, okay, what are we going to do? And so what we've done is we get involved in a bunch of different activities. And what's cool about that is that we're helping people, and we get to really reach out to people that need something. But our students get hands-on experience, and a lot of times they're using things they've learned in class, and then now they get to practice them with people, right? So they're also learning. And so out of that, what grew was a pro bono clinic, a free clinic a few years ago. And at first it was just voluntary, and we had some students kind of running it. And then a little over 2 years ago, we made it a mandatory part of our program. So now every student rotates through. They're paired up with a classmate. They're here for an hour and see a patient twice a week for 4 weeks in, say, ortho, and then they'll rotate and do the same thing for neuro, and then the same thing for kids. And they do that every semester in the program. And so what's happened is that we're serving these people that have no funding and need physical therapy, but they also get to practice their skills instead of practicing on each other in lab, right? They get to really touch people. And then I get to see how they're doing, so I can step in and show them things and kind of guide them. Or if someone's struggling with interpersonal stuff, we can meet and figure out ways to solve those problems, and really kind of head off any issues and just build their confidence. So it's kind of this win-win-win thing that's grown, And what's cool about that is we got to present on it at the national meeting this last year, and we've had 4 other schools reach out to us and actually come visit to see how we do this thing, because it's the biggest in the nation now. So, it's just being able to have that sort of impact, right?
Yeah.
Or some of the other service stuff we do, just the fact that our students are so willing to get involved, and then knowing that once they graduate, hopefully they'll carry that on. So that's the kind of impact I want to have, and our program supports that, so that's been really rewarding. Adapted-wise, I think it's just the growth of the program. Just the fact that so many kids now are coming and families are involved and people seem to value it. And then how many students come? We get 150 to sometimes 250 students that volunteer every semester. And I can tell some people come in, they haven't even been around kids, right? So they're kind of shell-shocked. And then by the end of the semester, they're like running around and, totally at ease. And just to see that growth is really rewarding too. Challenge-wise, I think, there's always challenges to our profession with healthcare changing, and it's hard for me when I first started and I worked in a hospital setting, and people, in rehab could stay for a couple months, and now they get like 2 weeks. And most of my background is neurological, so it's brain related, and we know the brain is able to recover, especially over that first year. Well, people are only getting to really work for a short period of time. That's really not fair, So that's frustrating that we can't make a change in that regard. Adapted-wise, I don't know that I have anything that really is frustrating. We've had to move a couple of times, and that's always hard, but Tiger they're the ones that were there when we started, so they've been very welcoming, so it's worked out pretty well, I think.
Good.
What keeps you motivated in physical therapy, like continuing your career?
Well, the bonus of having that free clinic is that I get to practice some too. So it's not just teaching. I mean, it is teaching because I'm right there in the moment, but we're seeing patients, so I get to share what I've learned over the years, and hopefully students can walk out, knowing stuff that it took me years to figure out, right? Or all my mistakes that I made, and then, but we get to actually work with people who are excited to come here, to see them change and get better. And then some of these people, neurologically, they're not supposed to make big changes after about a year has gone by. And some of these folks are 10, 12 years after their stroke, and we might only see them twice a week, but they're getting better. And that's kind of cool, right, to be able to see that change. So, so I really like that aspect. It's really rewarding.
Definitely.
And this setting is great because I get to, like I said, do the teaching thing, but also be a therapist. So
Yeah.
I get to do the two things I really wanted to do.
Yeah, that's awesome.
And the students make it, I mean, they're just so giving and generous of their time. And we're killing them in this program, right?
Mhm.
It's an intensive program, but they're like, oh, we need someone, okay, I'll volunteer. And, they're so generous. So that makes you feel good about things, right?
Definitely.
The fact that young people are just so willing to get involved. Yeah, I like that.
So you know they're in the right profession.
Keeps me going.
Yeah, exactly. Do you have any words of wisdom for a soon-to-be graduate student, and what would your words of wisdom be?
Yeah, what would that be? I think, just make sure if you're going to grad school that you're doing what you want to do. Really attack it. When I went to physical therapy school, it was an undergrad degree. So I was young, and I enjoyed physical therapy school, but I don't think I was mature enough to really understand all of it, and it wasn't until I went back to school as a grad student that I was just a different student, right? And so once you have that, I don't know, wisdom or whatever it is, you can really benefit more, I think, as a grad student. So just take advantage of that, that opportunity. And then just realize too that how much you can still impact people. So whether you're a graduate student or once you graduate and you start working, it's really easy to get wrapped up in what's going on in life, right? So many things are being thrown at you, so many things are happening. But I guess I would always like people to remember people need help out there. So even if you just volunteer for something, once a year, but still just keep that in the back of your head that, it's a cool thing to be able to do. It keeps you grounded.
Right. Kind of going along with that, what advice would you have for students like us or people in general to develop leadership skills aside from just surviving in a graduate setting, but to become a leader?
Get involved. Don't hesitate. Don't be afraid of it. Take advantage of it now, especially. If you guys got opportunities to lead at this age, that's really going to benefit you. And you won't look back and go, gosh, I wish I had done such and such, right? Just go for it, or experience something new, or try something. Or have you guys done any of the alternative break things? Yeah, what a great opportunity that is.
Amazing.
It's something I wish, looking back, I'm like, man, I wish I would have looked for something like that. So just take advantage of those things that are, especially if you're here in school, there's so many things just right here available to you, right?
Mm-hmm.
So, just if you reach out and try to do those things, I think it'll really benefit you.
Yeah, definitely use your resources.
Yeah.
So you kind of mentioned this earlier, but what specific values do you encompass that help you be a leader?
Yeah.
You can restate yourself if you feel like
Right.
it.
Well, and I think it's anybody that really wants to be a good leader. I think, it's getting involved, just willing to get involved, being able to kind of say what you need to say, but also do it in the right way.
Mm-hmm.
And that's a challenge at times, right?
Oh, yeah.
For anybody.
Mm-hmm.
So, but I think, it's pretty obvious that if you have someone that just kind of bulldozes people, that's not really a leader, right? So finding a way to kind of guide people. So I think that's the kind of thing that I really value in a leader. Someone, sometimes being a good leader too is just helping someone else figure something out by just asking them some questions. You don't have to have the answers necessarily.
Mm-hmm.
That's where my boss is a great example because, he lets us try things. He kind of guides, but he doesn't tell me what to do necessarily.
Right,
So,
causing them to think
yeah.
and that kind of thing. What do you feel is the vision of adaptive gymnastics?
Yeah. We want to go worldwide. No, I think the next step is that, well, a couple of things. I want students to participate, not just PT students, but any student that comes and helps out, to think about, once they graduate and go somewhere, starting something like this. And it doesn't have to be gymnastics, it could be anything.
Mm-hmm.
But, it's real easy to get in touch with an activity that's local and say, hey, have you thought about doing this for kids that need extra help? And then as far as getting volunteers, you can go through schools, maybe you look at high school kids, churches, maybe you go to a local college, or maybe you, if it's a physical thing, you go to the local OT and PT clinics, or, there's a lot of opportunities there, right?
Right.
So I would like to see people do that, and we've had a few students do that, so that's good, right? And so we've got a place in Florida and a place in Michigan, and people have started things, a place in Arkansas. So I would like to see that, but I want to be able to offer some things to some of the kids, so maybe as they begin to function better and can follow directions, I think the next step is we're going to offer kind of a Special Olympics opportunity, because they're able to do that through Special Olympics. And so I know there's things I have to learn first. Apparently there's some coaching involved that you have to know some things. Lucky for us, we're with Tiger Academy, and we've got some students that are gymnasts, and so I can probably call on them. But I would like to see some of those higher functioning kids maybe take it to another level and do something, get out and do something more than just run around on a Sunday.
Mm-hmm.
Yeah.
That'd be awesome.
Yeah, we'll see.
Anything else, guys?
I feel like a lot of these are repetitive.
If you had the chance to go back and do everything over again, the same path you did, would you do it again?
Absolutely.
Absolutely.
Absolutely. I love where I'm at. I wouldn't change anything. I'm so lucky.
Definitely.
Seriously, this is, yeah, I wouldn't change any of it.
Awesome.
Yeah, it's worked out beautifully, so I'm pretty lucky that way.
I do have a question that's not on here, but I just kind of thought of it. How did you get involved in the teaching aspect?
Yeah, well, okay. So I've been working in the clinic for a while, and it's really funny. I lived in Wisconsin and moved here, and I was literally in that clinic for like a week and a half. And one of the faculty from here came over and just wanted to meet, introduced herself. She taught the neuro stuff here.
Mm-hmm.
And she said, would you mind if I videotaped you working with some patients so we could use it in class? And as we talked, she said, you should come over and do a lecture. And then that became, a lecture and a couple labs. And then that became, I was the TA. And then next thing you know, they had an opening that I applied for. And she was so generous, she basically gave up the neuro class, which is what she had taught for years, so that I could fill that role. So, having someone so generous like that to open the door to you, right?
Mm-hmm.
So that's how it all got started.
Very cool.
Yeah.
That's awesome.
Yeah, that's pretty sweet.
I think we've pretty much got on.
Yeah.
Do you have anything else any additional information or advice that you'd like to share that we haven't covered?
Maybe any future advice for anybody going into the health professions that you would give future leaders, I guess. I know you kind of covered that idea, but what value specifically would you want to see in a future healthcare provider?
Yeah, I think just that you value other people, that you really listen to them.
Definitely.
Our patients, sometimes you get wrapped up in the job and you start just thinking about doing your job, but remember why we're doing this, and that they're individuals, and a lot of it too, my experience working with, especially mostly rehab, traumatic brain injury or spinal cord injury, I worked with a lot of people that, their injuries were the result of maybe not making a good choice or not living a good lifestyle necessarily. And what I would remind myself all the time is they get treated just like everybody else. They get the same high quality care. So no judgments, everybody's the same, right?
Everyone makes mistakes.
Yeah, absolutely, absolutely. So that's something I really kind of strive to do with folks. And what was I going to say? I had something else I was going to say. I'm just so profound, I'm sure it was just earth-shattering. Anyway,
But definitely empathizing towards your patients.
And also,
understanding.
there's a good thing too is to get involved. So with healthcare being the way it is, and there are these challenges, insurance and all these, a couple of us here that are faculty are on the Missouri Physical Therapy Association board. And so we're involved in meeting with legislators, and talking about bills that'll help our patients or maybe help our profession or prevent things from happening. Our profession's been around 98 years, and there still will be little things that show up that they'll tag onto another bill saying physical therapy, they should no longer do this. And we're like, we've been doing this 98 years. What are you talking about, right? And so we have to go and remind legislators, here's what we do. We're not trainers. We don't exercise people. We're helping people recover from injury. And that's really valuable. But what I found is that, that's an area I didn't even pay attention to for 10 years. And then I got involved, and it's like, wow, this is important. And it's frustrating as heck because there are 3,500 PTs in the state. Well, showing up to talk to legislators, there's maybe 40 of us. That's frustrating, right?
Yeah.
And so there's times I'm going, why am I doing this? But then I remember, oh yeah, it's so my patients benefit, it's so my profession, and so you just got to vary that part of it and get involved. So that'd be a great way too to just stay aware of what's going on, even if you don't like politics. I don't either, but I realized it's a necessary evil. It's just something you have to deal with.
It's going to affect you, definitely.
So just be aware of that stuff, and if you get a chance to go and represent, it's a good opportunity. It's kind of a cool thing. So
yeah, definitely.
Yeah, just keep that in mind.
I've never thought about that.
Yeah, I hadn't either.
Yeah.
I hadn't either. So I kind of fell into it. When I took the job here, part of it was to handle the clinical affiliations, and it turned out that in the state there's 7 programs, and every 3 years it rotated as far as which school would take on this role of student liaison and talk to all the students in the state, right? And so part of that job was to be on the board, which meant I was exposed to this stuff, and it was like, oh, talk about eyes getting open. It's like, wow, I didn't even know this stuff took place, right? But how important it was. So now I can't leave it alone. So yeah, be careful.